Hello, today I will be presenting a case study on an infant skull. So, the protocol at Quest Imaging, Current Radiology, is to have a complete, in case of traumas or anything like that. Normally, it's only on one side if it's just a routine, but since since there was trauma, then there was an order to get both bilateral X-rays, radiographs. The patient was 9 years old and fell off the bed. And mom told me that she showed swelling onto the left side and feared for a fracture, and just got referred to the office and came right on over. The routine there is a PA, a TOWNS, and both laterals. Normally, it is two laterals due to the circumstance, but on a normal case, it is simply one lateral. So this was taken on a Carestream digital 14x17 cassette on a tabletop, so no grid. The patient was placed supine, and the second we did, the patient started sobbing and bawling their eyes out. Babies do not like to be put down on x-ray tables. This was annotated AP, and we can see that this is our AP due to the fact that we have our Petrus ridges completely filling our orbits. We can see that our marker was just in the light field. We had translucent sponges. It was very difficult to hold babies down. So we had translucent sponges here. Both of the holders were shielded. You have a good peek at Lottie's finger and Lottie's thumb. We also had mom shielded and holding the lower body. We can see the mandible, but that is not the area of interest. We can see these little alien teeth. We can see the frontal bone. If this will focus up, there we go. Frontal bone fully visualized. Occipital bones also, and just the side peak of the temporal bones. And the sutures seem to be there. These radiographs do provide good contrast and density that we can make out bony margins and suture lines. All right, so with the AP TOWNS, or AP, let's go to the AP TOWNS first. The AP TOWNS, we require a 30 degrees, not so much for a baby wheeze, 25 degrees, but the whole point of it is to get the dorsum sellae projected into the magnum foramen. And we have that right here. It looks like we might have lost some quality when we copied and transferred over, but you can, yes, there it is. You can make out, the dorsum sellae into the magnum foramen. You can see the Petrus ridges here, the occipital bones, and the frontal bone elongated due to our angulation. See the orbits, a bit of the mandible. Marker was just slightly out of the light field, but we did manage to catch it. This was cropped out due to the fact that we did have some fingers in this image, so we cut that out. This baby was completely shielded, just so we know. And the great thing about this, that we managed to get all the projections without any repeats. So that was very good. Minimized dose to patients, holder, and technologist holding. And now we can go to our AP. AP, we have the entire orbits filled with the Petrus ridges, as long as our occipital bone, Lottie's finger. We have the EAM right here in the dense portion of the Petrus ridges. We can see skin outlines. These show such great contrast and not enough density that we used, that we can actually visualize skin margins from the EAM. And the subcutaneous fat on the baby's cheeks, which is kind of cute. And we can see the teeth and the maxillary sinuses as they have not formed completely yet. We can see the Petrus ridges in the lower 1/3, which Bontrager is good for diagnostic quality there. Marker, good. Now we're going to go to our bilateral skulls. The left was the area of interest. Marker was there. it was left, but it was cropped out to hide the fingers since it was superimposed by one of the fingers. Holding a baby is really, really hard. So we made sure to not take it twice. So digital markers and annotation is completely acceptable there. Also here, we do see more Lottie's digits. We avoid those. But with this one, we can even see some cervical spine. Wow, babies. And EAM. We see that this is great positioning. The collimation could have been a bit tighter, but baby squirm and she was eyeballing her little eyes out. And we managed to catch these in between breaths. As you can see, the air-filled trachea here. A lot more full here. I'm pretty sure I exposed this one on an inspiration. She just stopped crying for a second and was getting ready to reload. We can see the bony, soft tissue structures. You can see the ears. We can see the orbits. And we can see the anterior clinoid process in profile. Right here. The orbital plates are also superimposed, indicating that there was no rotation and or tilt. So it's perfect superimposition here. Not so great superimposition here, but not worthy of a repeat at all, since the area of interest was the occipital bone due to the swelling onto the left side and because baby had some trauma. Baby came and had a good fall. So the orbital plates here are not as superimposed, but not worthy of a repeat. Air-filled trachea, EAM, Petrus ridges, and we can see the ears, the soft tissue, external auditory obtuberance. All right. We did have a lot of help. We used positioning sponges. We weighted the baby down. Mom was holding from the lower body. The technologist was holding on the upper body. Baby was shielded. And well, these all passed our diagnostic quality for Bontrager. We had enough density to make out, and well, these actually are really good because they show sharp bony margins, would indicate that there was no motion. At the time of the exposure, I was watching that baby like a hawk. It was on the rotor and exposed right when baby was inhaling, so there was no motion. Therefore, we have sharp, crisp, bony outlines. It has good contrast due to the fact that we can make out air and sinuses from bony structures, and it's not dense enough that it burned out the soft tissue structures. The collimation was good, not perfect, but babies are babies, and better to leave it a little open than have to repeat an exposure. Marker placement, I already discussed that. Digitally annotated for some of the images that we didn't have an opportunity to sneak it in there. And made sure to hold baby very still with positioning sponges, as you can see the faint outline right there. And that is my skull complete.